Hello. I first would like to thank RCOG and all the members of the committee for giving me this opportunity to present my abstract with title The Maternal and Perinatal in Vitro Fertilization Program Outcome in Tertiary Fertility Center in Bandung, Indonesia. My name is Natania Cuaca. I'm a general practitioner in Bandung, Indonesia. My colleague is Dr. Kevin Dominic Chandra Prawira, who has helped me preparing this research. And my preceptor is Dr. Hartanto Bayu Aji, who is practicing as a consultant in fertility and reproductive endocrinology in both Hasan Sadikin General Hospital and Bandung Fertility Center in Limijati Hospital. I do not have any disclosure. Infertility and pregnancy through in vitro fertilization or IVF are at a higher risk of abnormalities and adverse effects for both mother and child. However, there are no sufficient data evaluating the Indonesian IVF populations. Thus, the objective of this study is to evaluate the maternal and perinatal IVF program outcome and to provide better data for the healthcare providers. This study was part of a retrospective clinical audit of 2 private tertiary fertility centers in Bandung, Indonesia. Patient recruitment of this study was from 2014 until 2018 with data collection from February to July 2020. This study recruited all patients who conceived through IVF and was declared biochemically and clinically pregnant. We excluded patients who declined to participate and those unreachable through various limits of context. Patient demographics, obstetric history, and clinical history were collected from their medical records and completed using a researcher-administered questionnaire through vote. Obstetric outcomes were collected including abortion, early bleeding, gestational hypertension, diabetes mellitus, preeclampsia, eclampsia, twins, and multiple pregnancy. Prenatal outcomes including low birth weight and prematurity were also collected. A total of 269 patients were recruited from this study. The characteristics of the participants were shown in Table 1. We can see that most patients were between the age of 30 until 34 years old, at normal body mass index, suffering from primary infertility, undergoing short protocol, and had fresh cycle. For the maternal outcome in Table 2, we can see that 95.4% patients delivered by cesarean section. Abortion affected 26.8% patients. Early pregnancy bleeding occurred in 30.7% patients. Premature delivery affected 56%, while the rest delivered at term. For the perinatal outcome in Table 3, we can see that most patients delivered appropriate gestational age babies, with 16.7% pregnancy being twins and 4.1% pregnancy being multiple pregnancies. So for the conclusion, premature delivery, early pregnancy bleeding, and abortion were the most obstetric problem in this study. However, another obstetric and perinatal problems are still needed to be concerned and could not be ignored. Further studies with larger samples from all over fertility centers in Indonesia are needed to corroborate our findings. Thank you for your kind attention.